So we've had this curriculum in place for a number of years, and the goal is to produce leaders in medicine, but also to help the applicant and the student eventually understand the link between clinical medicine and research and how both of these things help to promote, advance, and improve medical practice. We're shifting a lot of our thinking now, and actually using immersion of the med students into the first year from like day one. So you're seeing patients from day one. And we're then integrating a lot of the biomedical concepts with that. And so, yeah, you'll have like, early clinical exposure. You'll have a lot of the foundations within that first year. And so for us, that first year is still your basic science year, but with a lot of clinical elements integrated in. The second year is still your clinical year. And then the third year is where we actually have you do research or get an advanced degree. And that's where you get a chance to, choose your own direction and get to pursue your passions. And if you think about it, there are very limited opportunities for you to do that within, all the med schools within the United States. And so this is really a chance to do what you want to do and to, utilize everything that you've done in the past to pursue what you're, passionate about.
It's fascinating. If you're having all this early clinical exposure in the first year and also doing the entire didactic portion, which many medical schools take 2 years to do in 1 year, how do you cram it all in? I mean, do they end up starting a little earlier or finishing a little later? I mean,
no, I think we try to integrate everything well.
Okay.
And I think you're able to process all of that information if you can link everything together. And so I think by integrating all these elements early on, you can kind of see how everything works together. And I think back when I was in med school, that was part of the frustration of things. It's like you would just sit there in class and read about things, but you would never actually see it. But I think here you get a chance to actually see that actually working, and then you learn that better and you process it better. And so it becomes, in essence, much easier for you to retain that sort of information and integrate it to other concepts.
Right. It becomes important to you.
Right.
As opposed to just
Exactly.
something academic.